All right, let's dive right into this explainer and uncover the hidden hurdles of treating a massive Indian health crisis.
Staggeringly, over half of all pregnant women in India suffer from anemia. It's an absolute public health emergency. The government actually provides free IV iron treatments. But on the ground, well, there's a huge disconnect.
So, why isn't the treatment working? To find out, researchers literally traveled to rural villages in Telangana. Bypassing just clinical data, they used in-depth interviews to uncover the gritty human realities behind those numbers. And what they found? A total contrast between sterile healthcare expectations and messy village-level logistics.
As mapped out here, solving this crisis definitely requires way more than just handing out the right medicine.
First up, empty shelves. Frequent IV iron stockouts at local health centers halt treatment before it even starts. This forces women to travel to distant facilities, but, reliable public transport is painfully scarce.
Like this frontline worker points out, patients are often forced to spend their own tight funds on private rides.
Making these multiple distant clinic visits also means severe daily wage loss for the whole family.
But beyond those logistical nightmares, they uncovered a massive, deep-seated psychological roadblock holding women back.
Doctors see a standard procedure, right? But patients actually hold deep, culturally rooted fears about injections.
Mothers were literally terrified the injections wouldn't suit them. That is an incredibly powerful cultural barrier.
So, here's the big question. How do we actually bridge this gap and deliver these life-saving treatments? Researchers outlined some rapid-fire recommendations to tackle both the logistical and human elements of this crisis. First, moving IV iron to local subcenters immediately removes those crippling travel costs and wage loss barriers. Next, empowering local health volunteers to accompany women provides crucial emotional reassurance against that intense needle fear. Also, actively engaging husbands and frontline workers as a support system dramatically drives up treatment completion rates. And to dispel deep-rooted myths, clinics can easily play culturally sensitive educational videos right in their waiting rooms. They even suggest using traditional pregnancy celebrations, like God Barai, to encourage clinic attendance and build trust. Ultimately, how do we balance medical protocols with human behavior? You always have to understand the human first.